In 2014, when the phase 2 results of the study that we're about to talk about right here at ASCO, when they were first reported, the headline for that was Moffitt Cancer Center's phase 3 study may be game changer for acute myeloid leukemia. Well, we're here to find out. So to do that, we are at ASCO and we're talking with Dr. Jeffrey Lancet, who is a senior member and a professor at the H. Lee Moffitt Cancer Center and Research Institute in Tampa, Florida. First off, thank you. You must remember those phase 2 results that came out that were quite positive.
Very well.
And so you're the principal investigator and lead author of this phase 3 part of the trial. First off, let's remind everybody about where we are with this particular agent and what we're talking about.
Well, CPX-351 has been around for about 10 years. It started out as a small phase 1 study and worked its way up through the ranks and eventually became a phase 3 registration study, which is what we were talking about today.
Now, in the case of the phase 2 study that got everybody excited, what did you find?
Well, in the phase 2 study, we studied the effect of CPX-351 versus 7+3 in a randomized controlled fashion to really identify more definitively what the clinical activity of the drug was, recognizing that in the phase 1 study there was a pretty good signal of both clinical activity and an intriguing pharmacokinetic profile. So in the phase 2 study we wanted to follow up on that and really understand how effective this drug was and could it potentially lead to more of a definitive standard of care type of therapy for this patient population. What we found was that in the phase 2 study, it was not the overall group of patients that benefited, but a common subgroup of AML known as secondary AML that exhibited the highest degree of clinical benefit from this drug.
High-risk patients.
In high-risk patients.
High-risk patients, certainly, weren't they? Now, in the case of what you're presenting here, let's talk about how many patients and what did you find?
So in this randomized phase 3 trial, we studied approximately 300 patients, and we found that the CPX-351 patients, or I should say that the patients that we studied were patients with high risk, primarily secondary AML. And within that group, there was a statistically significant overall survival advantage compared with the traditional 7+3 type of chemotherapy. So that was the main finding of this study.
Now, where does this put us? I mean, it's kind of exciting. It's got some real possibilities here, but where is this going to fit in, do you think?
Well, I think based on the results of this study, we may have a new standard of care for older adults with high-risk AML, based on the fact that the CPX-351 drug did induce a longer survival compared to 7+3, and that's usually the measuring stick by which the regulatory authorities will determine whether a drug should be approved. So we feel that the results were compelling enough to strongly consider this drug as the next standard of care for patients with high-risk AML.
So are you going to the FDA in order to try and get them to look at the data?
So yes, so the data will be presented to the FDA in the near future. An NDA will be submitted, and hopefully, the results will be reviewed and viewed favorably. And by this time next year, we'll maybe have a new standard of care drug for AML, something we haven't had in forever.
Now, in the case of what's next, are you doing more research? Is this kind of where you're going to leave this for a while?
Well, the next steps, I think, are varied. There's a lot of interest in developing this drug further in different populations of AML, including lower risk patients, younger patients, and even the more frail elderly patients using a lower dose. So there's interest in expanding its current use with a similar disease states, but somewhat different populations. Additional interest has been generated in terms of combination therapy with CPX plus perhaps targeted therapies or other novel agents to really expand on the benefit that we saw with the agent in this phase 3 study.
I mean, congratulations, because it's not often when you do get a phase 2 result that is that positive that then follows through in the phase 3 setting so well as this one.
Well, thank you. I think to me what this highlighted was the importance of something very basic, which is drug delivery. And there's nothing really magical about CPX-351. It's a combination of two drugs that have been around for multiple decades, but they're formulated in a way that allows the drug to get to the target cell in a more efficient way that we think leads to better cell kill. So it's all about drug delivery, and to me that's kind of a low-hanging fruit that we've finally been able to take advantage of, and hopefully this will provide the platform for future drug development with not just new drugs, but drugs that we're currently using in their current form.
Well, thank you for chatting with us here at ASH Clinical News, and please make sure you check out the rest of our coverage from the ASCO meeting online and in print. And for American Medical Communications, I am Executive Editor Rick McGuire.